It's great to see you. I'm glad you could make it in this morning. I heard that you have some very exciting news. Well, that's wonderful. And I'm here for you. My job as an obstetrician is to make sure that pregnant women like you are healthy, stay that way, and deliver a healthy little bundle of joy in just 9 short months. Now, I know that we're still very early on in this, but one of the most important ways to stay healthy and deliver a healthy baby is by starting and staying in a healthy weight range. And this is based on something we call the body mass index, or BMI. Have you heard of that? Oh, great. I'll try to explain a little more here for you. BMIs are calculated by using computer programs and mathematical formulas that compare a patient's height and weight. But lucky for us, we don't have to calculate it ourselves because we have charts like this one that have already done so. So you see, it lets me know based on your height and weight whether you're underweight, in a normal weight range, overweight, or obese. We'll measure yours a little later. But here, let me give you an example right now to help you understand. Let's say I have a young woman walk in who's thinking about becoming pregnant. She's 5'2", weighs 120 pounds. Now, using this chart, we'd find 5'2", 120 pounds, and then trace down to our BMI right here. So what range does that put her in? Right. She's in the green area of this chart, meaning she's in the normal weight range, one with a BMI of between 18.5 and 25. If she were in the yellow range over here, she'd be underweight with a BMI of less than 18.5. And if she were in the yellow range on the other side, then she'd have a BMI between 25 and 30 and be overweight. If we charted her in the red-pink area with a BMI of 30 or above, then she'd be obese. Now, I've got to let you know that when we measure your BMI, we'll calculate it with your pre-pregnancy weight. What was that? Yes, exactly. Because we don't want to skew the results. So that means that any weight you may gain during your pregnancy won't figure into your BMI and how much additional weight you should gain while you're pregnant. Great question. How much additional weight is that? We'll determine your BMI in just a few minutes. But if you're in the normal weight range, you'll need to gain between 25 and 35 pounds during your pregnancy. If you're underweight, you'll need to gain a little more than that so that you and your baby can stay healthy, about 28 to 40 pounds overall. And if you're overweight, you'll only need to gain between 15 and 25 pounds when it's all said and done. Not as much as those in a normal weight range. For women who fall into the obese category, I sit down with them individually and help them figure out exactly what they need to do. It's not as easy to give them a blanket recommendation for how much to gain. You understand? Good. You'll want to do your best to make sure you gain weight at an appropriate pace. It'll be about 1 to 3 pounds per month for the first trimester and 1 pound per week during the second and third trimesters. You're right. Not all of this weight gain is fat. You've certainly done your homework. Your baby is growing and parts of you are too. Your placenta, your uterus, extra breast tissue, and more blood and more amniotic fluid. So a lot of this is where that extra weight comes from. How do you go about gaining the weight? That's a great question. You still need to stay healthy. You don't just go around eating everything you can get your hands on. Of course, you know that. There's a difference between healthy weight gain and unhealthy weight gain. Now, here's what healthy weight gain should look like. You'll need to get between 300 and 400 extra calories every day. That's the good, nutritious calories rich in vitamins and minerals. Now, I generally recommend that my patients eat a variety of healthy food from all the food groups, especially fruits and vegetables. If I were you, I'd try to get around 3 cups of vegetables every day and 2 cups of fruit, without a lot of those added sugars or fats. In fact, some research I did a few years back showed that the best pregnancies were associated with eating more fruits and veggies. And I'll give you some recipes before you leave to help you. Now, what kind of milk do you drink? Good, good. Keep drinking the skim milk. If you were drinking whole milk, I'd have you cut down to low fat or skim, because you'd still get the calcium and protein from milk just without the extra fat in whole milk. So try to get about 3 cups of milk per day. Can you do that? Great. Yes, about 3 smaller meals every day and a couple of healthy, nutritious snacks thrown in would support healthy weight gain and healthy nutrition throughout your pregnancy. Oh, and do your best to avoid fried foods. If you eat fried foods too often, you could gain too much weight, which would be unhealthy. And you know what else you could do? Get a little exercise too. The benefits of a good 30-minute walk or a quick swim are incredible. It helps keep your weight gain on target and will help you feel better overall. It's the little things that make all the difference. Oh, my goodness. I feel like we've been talking quite a bit. Yes, it has been mostly me, you're right. But let's get you out of here and we'll see if a nurse can figure out your BMI, okay? So off we go.